Hi, my name is Lucia Amado. I'm one of the infusion nurses here at the Neurology Center of New England. I'm joined today by Carolyn Debeauport, who has a special interest in migraines, and we're here to talk to you today about one of the new medications that was recently FDA approved called VYEPTI.
We're both really excited to be able to provide a video to give you a little more information about some of the newer medications that have come out, and this is our latest and greatest. It's called VYEPTI. It also has a longer name of eptinizumab. So it's got a little cute name called EPTI right now to be a little bit easier for patients to remember. It's a CGRP antagonist. You've heard about these medications probably over the past year or so. This one is the first intravenous infusion that is a CGRP antagonist, and we're pretty excited about it. It's fast, it's powerful, and it has sustained relief for patients. It's also good for patients that may not feel comfortable giving a self-injection. The medication is going to be a quick infusion that Lucia can tell you a little bit about.
Yep, relatively quick. The actual infusion itself is going to be about 30 minutes. We are telling people to really plan on an hour. We're going to do a pre-assessment on our patients when they come in, which will include vitals and see how you're feeling, and the actual venipuncture to start your IV, and the medication. And then, as per our protocol here at the practice, is we like to have some observation time just to monitor the patients, making sure they're tolerating it well, especially in light of the fact that it is a new medication. So it has few side effects. People, according to the PI of this medication, have tolerated this medication very well. I think the most common side effect was a stuffy nose, so we're really excited to offer this option to people.
I'm going to just speak briefly about what CGRP is. A lot of people have been hearing about this and might want to know a little more about it. CGRP is actually a protein that is located in the body. It's involved in the brain tissue, and it's also located in some of the other tissues as well. And when it's responsible for the transmission of pain and the actual reaction that occurs in the tissue and blood vessels. So some of these medications are blocking this from occurring, and it's part of the migraine cascade. There still is no cure for migraine, but we're coming up with much better treatment options for our patients. So with this, I wanted to just reiterate that it's a quick infusion. The data that they've shown on this drug actually shows that patients on day one had 50% decrease in their their migraines. 50% after day one with the treatment is quite powerful and quite fast. Again, the infusion itself is going to be about 30 minutes in duration. It has sustained relief because after about 6 months of treatment with this medication, which would be 2 treatment cycles, they had about a 50% decrease in the frequency of people's migraines overall. 1 in 3 of those patients actually had a 75% decrease in the frequency of their migraines.
It's so important. It's so huge. We see so many people come back. We offer them the best options that we have. And this is just something really new and exciting that we can offer patients that are really suffering with these migraines. So thank you very much for joining us. And hopefully we'll see you in the office with VYEPTI.
Stay safe and take care.